When the pandemic first hit, the American Cancer Society recommended that doctors postpone any routine breast cancer screenings or intervention to protect at-risk patients from potential exposure or illness. Well, earlier this month, they shifted gears and are now telling patients to resume regular breast cancer screening. So what changed, and is it safe for patients? Dr. Stephanie Schnepp is a surgeon and medical director of SSM-Health St. Mary's Breast Center here this morning. Good morning to you.
Good morning. Thank you.
Good morning. Well, has breast cancer treatment in general taken a bit of a hit? How did that affect patients?
Well, first, we never completely stopped seeing patients. We were still throughout this whole time continuing to see anyone who had any new concerns, who thought they felt something different in their breast. We were still doing those diagnostic exams, ultrasounds, biopsies. We did change the urgency of the treatment and how we, prioritized the timing of the treatment in some cases, sometimes delaying surgery in favor of other treatments up front. But as far as the screening process, that's what changed. If someone was just to come in for their routine annual screening mammogram, we were delaying those at most of the area hospitals between the end of March and the end of May. We did resume those screening services at the end of May, and we've been encouraging people to come in and catch up on what they've missed during that time. Missing a month or two, may not be much of a delay, but at this point now we're going on, 4 to 5 months. Someone may have delayed their mammogram if it was due in March, and that's when we think it's getting to be a little long, and things could change within that breast tissue. So the sooner someone comes in, the better it would be for us to be able to still find something as early as possible.
Right, and so, patients might be saying, okay, now I can make my appointment. What safety protocols are put into place for patients so they do or may feel safer?
Right. We have actually used this time when we were at a lower volume to figure out how to make our environment as safe as possible for patients. And we have. Of course, everyone is wearing masks throughout all of our buildings, and we have for months, way before it was mandated by the area. And we've had no problem with patients agreeing to that and cooperating with that. We've limited the number of people coming through the building. It's only patients and one visitor at most, and that just recently started even. The waiting rooms have less chairs and more spaced out chairs. We're trying to time the appointments so that people aren't gathered in waiting rooms for long times. At the registration process, we have, of course, the plexiglass barriers in front. And then as people go back, we've changed the process of how you go through the department. People are used to change in changing rooms and leave their things in lockers and have a shared key for those lockers. That's no longer being done. People are coming straight from either the changing room or even changing sometimes in the mammogram room itself, and then doing the exam in there. And then, of course, between patients, there's a lot more cleaning that goes on.
Right.
Of course, hospitals were always very clean places in the first place, but as far as surfaces like door handles, chair handles, all of that is being cleaned much more than before. So we've really put a lot of thought into how to make this as safe of an experience as we can for patients. We've also changed the entrances and exits, so there's one-way traffic, just like you're seeing in other places too. So as far as choosing a place you could go right now, coming in to get your mammogram may be one of the safest places that you could go right now in public.
All right, doctor, perhaps you've put some minds at ease. We appreciate the insight this morning. Thank you so much for joining us. And if you'd like more info on breast cancer screenings, we've got a link for you on our website, as well as our Fox 2 mobile app. Time to take a break.